The respiratory system. We want to look at histologic characteristics of components of the respiratory system, both the conducting portion and the respiratory portion of the respiratory systems, and how these characteristics allow each component to contribute its function towards gas exchange with the external environment. All higher animals require a mechanism to obtain oxygen from the environment and get rid of metabolite byproducts, carbon dioxide. The respiratory system exchanges these gases with the external environment. You have a conduit that goes to the external environment and goes down into the lungs for the exchange to occur. Today we want to talk about the histologic characteristics of the components of the conducting portion of the respiratory system and the respiratory portion of the respiratory system, and talk about how these characteristics allow each component to contribute to the function in gas exchange with the external environment. Now here we can see the respiratory system, starting with the nose and mouth, going down through the neck with a series of branching into the lungs itself. If you look at one of those branching into the lungs, you can see that there are air sacs and alveolus, and in the wall of the air sac are blood vessels. So blood vessels go very close to the airspace inside the wall. Now, what's the function of the respiratory system? In two words, the function is gas exchange. Oxygen in and carbon dioxide out. So oxygen comes out of the airspace to alveolus into the capillary, and carbon dioxide goes out of the capillary into the airspace to be discharged. Here again we can see a atlas view of the lungs. You can see the tracheal rings in the trachea. We can see the bronchus coming in through here, and then ultimately you have bronchioles. We see one of the lobes of the lung, and we see respiratory bronchiole, alveolar duct, as well as the alveolus. Now, if we start with the nose, here we see the human nose. Individual was cut, once his deceased, was cut in half, and so you could see the nose between the eyes and the cavities of the nasal cavity. Here in body worlds, you can see that a cut in a different profile, and you can see these turbinates. These are the different three turbinates in humans. And in these turbinates, here we see their swell bodies. Swell bodies are blood vessels that can engorge with blood, and in doing so, it impedes the airflow. So the air is going through these areas right in through here, and whenever the blood vessels are filled, it closes the airflow, so that every 30 minutes you're breathing more out of one side of your nose, and then in the next 30 minutes you're breathing more out of the other side of the nose. And these swell bodies close the airflow to a given side for 30 minutes and then switches every 30 minutes, and allows the lining to rehumidify, because as the air goes through the space, it causes the tissue to dry out. So it rehumidifies whenever it's closed down. And we've seen these things that the various players have. They call it breathe right. I call it breathe wrong, because it holds your nose over the swell bodies so that the swell bodies are not engaged, so you breathe out of both nostrils. It's okay for a game, but it's not okay all the time. And here we can see the different turbinates in a different view, and in the one in the top we see olfactory epithelium. So this is epithelium, olfactory epithelium, with the cilia projecting into the airspace to be airspace right in through there, where they can smell the different components, one of the five senses of the body. And so here we can see the olfactory mucosa, and you can see the epithelium on the surface is stratified, pseudostratified columnar epithelium. Also, we can see glands in there. There's these glands, olfactory glands, that push the contents up and kind of trap some of the odors in the surface. Here we see the larynx. Larynx has the true vocal cords, which has stratified squamous epithelium on its surface. The respiratory epithelium is located in the other portions of the respiratory system, and that is pseudostratified columnar epithelium with ciliated cells on there. We see the muscle for the vocal cords, and we can also see the cartilage. So this is a true vocal cords, and this is a false vocal cords that we see, but we see some lymphoidal tissue there in protection of the airway, as well as we see some glands for to humidify the area. Here's a false vocal cord, like we see here, and then this is the true vocal cord that stratifies squamous epithelium on its surface, and then connective tissue below. And this is a muscle with a series of cartilage as you go down toward the trachea. There's just higher mag of that, showing you the respiratory epithelium is everywhere except where the vocal cord vibrates, and that causes it to be stratified squamous epithelium, which is a abrasion resistant type of epithelium. In the trachea now, we see the tracheal rings. The ring, it doesn't make a complete circle, and in between the U portion of the tracheal U tube, you have a muscle. There's a muscle there that can contract. When it contracts, it reduces the volume of the trachea, and so you can blow some out if you need to increase the volume. And here we can see there's esophagus up here, but here is the trachea. You can see the cartilage there. Also, there's glands and the lamina propria that's located in through there. This is the muscle, the smooth muscle that pulls the two cartilage components together, and you can see that there kind of serous and mucous glands in there with respiratory epithelium and the air going through this space. Here in a monkey, we can see another profile of a trachea, showing you the glands which are going to discharge its contents, and we can see the basal bodies of the cilia, and also the goblet cells. So we have pseudostratified columnar epithelium with goblet cells in there. We can see those again. There's the basal bodies, here are the cilia, these are the goblet cells, and then these are the pseudostratified columnar epithelial cells. Columnar epithelium here, but there are some basal cells at the base of that. Again, we can see the goblet cells with their secretions. It's a scanning electron microscopic view of those. We can see they have villi on the surface as opposed to cilia on the ciliated cells adjacent to that. Below there, we can see that the epithelium has a very, very thick basal lamina. The basal lamina is actually visible at the light microscopic level, the characteristics of the trachea. Also under there are some immune cells. In fact, we can see plasma cells here, here, and here, which would be producing antibodies that would be interacting with things in the mucosa. So we can see there's different types as we come from the trachea. What branches from the trachea would be the bronchi, bronchioles, the bronchus, the bronchi, I should say. And here we can see one bronchus. There's one over here. If you still have cartilage, even though they're just plates, they're not a circle anymore, you can see them there. That would be the bronchus. Now, in contrast, if you no longer have a cartilage plates, you have a terminal bronchiole. And so this is a terminal bronchiole right in through there, and we can see it over here. So we have no alveolar opening in the terminal bronchiole. Now, in contrast, the respiratory bronchiole looks very similar, but it has outpocketings into the alveolus. And here we can see alveoli right in through here, but this doesn't branch out. So this is a terminal. These are alveolar ducts right in through there. Alveolus and the alveolar ducts would be a profile of these with alveolus in here. So here we see another bronchus with the cartilage plate. We can see the smooth muscle run through their respiratory epithelium there as well. And so here's the respiratory bronchiole. So this would be like part of a terminal bronchiole right in through there, but this would be a respiratory bronchiole here and here, because we have outpocketings, and these would be the alveolus and the alveolar duct right in through there. Now again, we can see the bronchi. Here's one bronchus here. There's another one right here with the cartilage plates. There's another one right here. So you got different sizes of bronchi. And that we see here. This is a blood vessel here. This is a big vein that runs through here, so you can get blood into the lungs. We see some black around through there, which is really the macrophages that we see. If you look right in through there, we can see this is a bronchus, and you see a respiratory epithelium again with the stratified columnar epithelium with basal bodies and cilia and goblet cells. Also, the larger bronchi actually have serous and mucous glands that discharge into the lumen. Here you can see a mucous component and a serous component. Here we see smooth muscle in through there, blood vessels are running through, plasma cells, a host of plasma cells in through there, and again goblet cells associated with the pseudostratified columnar epithelium, and of course we would have a cartilage plate. And so if you come down from here, we see this would be like part of a terminal bronchiole, and then this would be respiratory bronchiole alveolar ducts that we can see, and here we can see some cells of the terminal bronchioles, where they have these Clara cells on the surface. And here we can see again, we can note various components in this profile. Again, you got the height of epithelium is reducing as you're getting closer and closer to the respiratory bronchiole. So this would be like a terminal bronchiole, ciliated cells, and also note these dark things here. This is elastic fibers that allows the lungs to open back up. And also note there's lymphatics as well as blood vessels which are cleared. You can see there's lymph vessels to drain the fluid out. Here we see a mast cell, and here we see alveolar duct, blood vessels, smooth muscle in through there. Well, similar type thing, pseudostratified columnar epithelium with the height being reduced, smooth muscle layers to constrict the flow of the bronchus and the bronchioles. And here we can see artery, part of our artery there, and it actually has cardiac muscle in it, in that particular artery. Here we see a nerve. We can see here with the myelinated axons and the perineurium on the outside. Muscle layers, we see there's a little piece of nerve right in through there. Blood vessels in through there. And here is a lymphoidal infiltration that's located in the lungs, as well as fat cells that we were seeing there. So here we can see the mitochondria and the striations of the striated muscle that's lining arteries. So in the arteries of the lungs, you can have cardiac as well as smooth muscle lining that. And here we can see the alveolar duct, alveoli, and then you can see some blood vessels with red blood cells that are in there that we can see. So if we look again, there's a piece of a lung. This is a lobe, and here in the lobe we have the respiratory bronchiole, alveolar duct, and alveolus. Note that you do have lymphatic drainage. We saw some lymphatic vessels before, and you do have arteries and veins there as well. Also, around each one of these you have is laced with blood vessels. There are blood vessels in through there. So you can see combination of blood vessels in the wall of these. Here we can see a red blood cell that's in the wall of this It's within the capillary that's located in the wall. Also note down around each one of those we have elastic bands, and so elastic that help close down the lungs after it has expanded. And so here we can see a similar type thing. So we respiratory, bronchial, alveolar duct that we see here, alveolus, and these are alveoli with blood vessels in the wall. Again, we can see a terminal bronchiole here and here and here, and then we have a respiratory because it has little outpocketings to the alveoli. And then here we can see the terminal bronchiole would be right in through there, respiratory bronchiole, alveolar ducts, and here and here. And sometimes you can see little pores that go in here. But one thing I wanted you to see right in through here are these cells. These are macrophages. So they're dust cells or macrophages that help gobble up the components. Here we can see one of those here. Here you can see some pigmentation in that particular one. So these cells are free in the alveoli. However, don't confuse that with another cell that's in the corners in through here. That's a cell that produces surfactant. That's a type 2 pneumocyte. The type 1 pneumocyte is the cell that lines the airspace right beside the capillaries. This is the capillary and this is the airspace. You see how thin the barrier is between the blood and the air. And so this is one of these cells, which is a surfactant secreting cell. Here again we can see a type 2 and a type 1 cell in the lung. If we look at electron microscopic view of the surfactant, you can see the lamellar bodies that are in there, lamellar layers, and this kind of just unfolds in through there, provides surfactant on the surface of the alveolus, and that will allow you to be able to close the airspace and then open it again, because it reduces the surface tension that would be associated with it. If you ever try to open a plastic bag that's wet, you know how it sucks together and stays together. Well, if you had surfactant in there, it will not be stuck together, and that's what happened. Here you see one of those type 2 cells here and here, and we can see those around here in this profile. These are the type 2 cells. Here we can see the blood vessels and the alveoli in through there as well. Again, the type 1 cell located in there, probably a type 2 cell there, right there. But also there's macrophages in here which gobble up carbon that we can see. This is just another profile showing you the cardiac muscle. We can see the intercalated disc right there, as well as the A and I bands. All these, and these right through here, these dark things here, is elastic tissue that's located in there. And we kind of see a type 2 pneumocyte here and here with the bubbles, which are really a surfactant molecule. So we start out with the trachea, the bronchi, and then the bronchioles are at the very end, and you have the terminal bronchiole, respiratory bronchiole, alveolar duct, alveolus, and also there's little pores that run between the alveoli to allow air to equalize within there. Blood vessels in the wall, elastic tissue in the wall as well. So the function of the respiratory system is gas exchange. You get oxygen in and carbon dioxide out. And note that the air doesn't go in to the blood vessels, it's the oxygen, and the carbon dioxide comes out. So the higher animals required a mechanism to obtain oxygen from the environment and to get rid of the CO2.